That part of the nervous system that controls involuntary reactions such as sweating, heart function, digestion, and sleep is known as the autonomic nervous system. And as you know, there are two branches: the sympathetic nervous system, that's the fight, flight, or freeze reaction, and the parasympathetic nervous system, that is the rest and digest or feed and breed response. Fight, flight, or freeze. Physical injuries, anxiety, stress, digestive disturbances, tension, and insomnia are all connected to a hyperactive sympathetic nervous system. Fight, flight, or freeze. Physical injuries, anxiety, stress, digestive disturbances, tension, and insomnia are connected to a hyperactive sympathetic nervous system. The sympathetic nervous system prepares the body for fight, flight, or freezing by heightening alertness. This can result in increased anxiety and decreased ability to sleep. Shifting blood flow to the muscles, which leads to, of course, decreased digestive function. Increasing blood flow to the muscles, eyes, ears, and nose, so you can focus on the immediate danger. This, of course, results in higher blood pressure. Adjusting the nervous system for fighting, which leads to decreased fine motor skills. Adjusting vision and hearing to focus on the danger, which results in tunnel vision. And increased ferocity, which leads to decreased sexual function and decreased sexual appeal. Fighting is survival because you might be able to overcome the opponent if it's a living thing or if it's an environmental factor like a hurricane. Flight is useful because it might save you from an overwhelming opponent or from severe environmental factor. Freeze does have a survival component. Sometimes if there's no time to escape, if you simply are quiet and still, the attacker may not see you, or if it's a wild animal, may consider you not as dangerous. After the emergency is over, the sympathetic and parasympathetic nervous systems normally rebalance. Sometimes the sympathetic nervous system stays locked in for hours, days, months, weeks, or even longer, leading to chronic anxiety, sleep disturbances, digestive disturbances, high blood pressure, poor fine motor skills, poor concentration, and erectile dysfunction in men, as well as low fertility in women. The vagus nerve historically is known as the pneumogastric nerve, pneumo meaning lungs, gastric meaning digestion. It is the 10th cranial nerve, or CN10, and it interfaces with the parasympathetic control over the heart, lungs, and digestive tract. It comprises two nerves, the left and right vagus nerves, but they are typically referred to objectively in the singular. Activating the vagus nerve effectively reboots the autonomic nervous system and reestablishes the all-important balance between the sympathetic and the parasympathetic nervous systems. We activate the vagus nerve with targeted nutrition and specific acupuncture points to reset the nervous system and allow a person to regain normal balance, or at least their physical body to regain normal balance. Let's take a look at the first and most important product that I believe for this, and that is Simplex F. Simplex F supports the healthy function of the pituitary, thyroid, adrenal glands, and the ovaries or the testicles. Simplex F for female, Simplex M for male. Simplex F or M is great for restoring balance when the sympathetic nervous system is dominant. Simplex F or M is one of the three products that I start every single one of my patients on. I do this because I know it will give quick results. Simplex F or M supports the main endocrine axis of the male or female body, so you really can't lose. Organically bound minerals is the next product that I recommend for to reset the parasympathetic nervous system. The dose is 2 twice a day. It encourages healthy enzyme functioning, which is dependent upon minerals. It promotes healthy connective tissue. maintains high cellular energy production, supports the nervous system, and is a source of iodine to support thyroid function. Organically bound minerals is an extract of alfalfa and tillandsia. Tillandsia is Spanish moss. The water-soluble factors from these two products contain all of the alkaline ash minerals. And if anyone needs to refresh on an alkaline ash mineral, that simply means when you burn something down, if you measure the ash, it's either alkaline or acid. And if it's alkaline, they're considered to be an alkaline ash mineral component. A Cataplex G, 2 twice a day, is another very important product and part of the main protocol for restoring nervous system balance. Cataplex G maintains nerve health and provides a calmative effect on the nervous system. Cataplex G works by relaxing the arterial wall so that blood can flow more easily into the body, promoting relaxation, warmth in the extremities, color in the skin, and it's great for anyone who has high blood pressure, which I covered in greater detail in our high blood pressure webinar. Adrenal complex completes the basic protocol for resetting the nervous system. It restores adrenal function, supports adrenal gland health, and helps the body adapt to the challenges of everyday life. I advise my patients with high-stress jobs to keep some on hand and suck on the caplet like a lozenge when they're feeling stressed. You do have to be a little, this does contain licorice, and you do have to be a little careful of it for patients who are on high blood pressure medication. Ben or I could help you with that if you have a question on that. Valerian complex, this is used for people who specifically have trouble with sleep. The dose is 2 to 3, 1 hour before bed, and it may be repeated during the night. This is great for difficulty falling asleep, frequent waking, irritability during the day, restlessness, anxiety, and nervous tension. This is a great formula with sedative, sleep-inducing, and anti-anxiety activity. Anxiety is best handled by addressing the source, by addressing the persons and situations that are the source of your anxiety. By taking valerian reduces the effect of the stress on your body so that you are more able to handle the people and the situations that you need to handle in real life. Crampax. This is for any type of smooth muscle cramping, and the dose is 3 twice a day. Great for GI tract spasm, prostate pain, ovarian pain, menstrual cramping, and chest pain. This is an ideal formula for any type of smooth muscle spasm or cramping, including IBS, colic, and gallbladder spasming. Hawthorn, 2 twice a day, traditionally used to support healthy function of the heart muscle, help promote cardiovascular system health. In Europe, this is a very popular herb, and it's called the nurse for the aging heart. Traditionally, it's used as a heart tonic to treat any cardiac disorders. It's also very effective for high blood pressure, but slow to act, taking a month or 2 before it starts to bring the blood pressure down. Nevton Forte, twice a day. Traditionally used to calm the nerves and restore balance in temporary mood swings. This is a great formula for the nervous system. It promotes a feeling of well-being while calming the nervous system. I've combined all this to you in a brochure that you can simply hand to your patients or email to them, reducing the workload for the practitioner and providing the patient with a quick source. I'll go through this with you. Right over here is the link that they can click that'll show them the acupuncture video that you'll see in just a couple of minutes. Now, this page here we've seen before talks about how to locate the acupuncture points and using certain terms, introducing terms like superior, inferior, proximal, and distal, so we can be on the same language. And here are the points. We're going to cover that in the video in a couple of minutes. I took great pains to show patients how to get the actual point on the ear, and of course we have the other points We'll cover those in just a couple of minutes. Here are the standard process supplements. Over here in the beginning, you see the basic protocol, Simplex FRM, organically bound minerals, Cataplex G, adrenal complex. Also consider valerian complex for sleep support, Crampex if they have smooth muscle spasm, Hawthorne if they need heart support, and Nevton Forte for nervousness. And finally, here's the medical advice disclaimer to keep you on the right side of the FDA. Now, I have another resource for you and your patients, which are these courses that I built and are available for your patients. Through video lessons, illustrated downloads, quizzes that promote understanding, and real-world practical assignments, students gain the knowledge and know-how and skills to help themselves and others with acupuncture. The courses take 3 to 4 weeks each and cost $199. I have set it up so that you can receive a 20% commission on any purchases made by customers who find our website from your website or social media posts. And you receive a 20% commission on any other courses that they purchase for the next 12 months, whether or not they come from your website. We put a little tag on their file, and we mark them as your referral. So if you're interested in all, or you want more details about this, just info me. Okay, vagus nerve activation. Let's take a look at the video.
Hello. In the next 2 minutes, I'm going to show you how to unlock the power of your vagus nerve. While most nerves in the body reach the brain via the spinal cord, the vagus nerve is one of a small group of nerves called cranial nerves that connect to the brain directly. Vagus comes from the Latin meaning wanderer and is the longest cranial nerve extending from the brain to your upper digestive tract. The vagus nerve is part of the autonomic nervous system that controls involuntary reactions such as perspiration, heart rate, digestion, breathing, and metabolism. Vagus nerve stimulation is used to calm the body when you are anxious, stressed, have digestive upset, or are having trouble sleeping. This powerful effect of the vagus nerve was well known to ancient healers, and current neuroscience research has validated its effects. Vagus nerve stimulation has been used for self-healing, headache relief, restoring normal heart rhythm, and reducing nervous system overload. In this video, I'm going to show you how to locate and activate 3 acupuncture points to activate the calming effect of your vagus nerve. It is recommended that you use all 3 acupuncture points because they form a powerful trio to unlock the calming effect of your vagus nerve. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified as more videos come out. The first point for vagus nerve activation is the master autonomic nervous system point. The master autonomic nervous system point is used to restore nervous system balance, reduce pain, improve blood circulation, improve digestion, and calm the heart. The master autonomic nervous system point is said to help with asthma, stress-related health disorders, and to promote restful sleep. The master autonomic nervous system point is located on your ear. To determine which ear to treat, press your right nostril, breathe in and out, like this. Then press your left nostril and breathe in and out. Notice which side does not breathe as well. Select the ear on the side that doesn't breathe as well. For example, if the right side breathes good and the left side doesn't, you're going to be treating the left ear. Very occasionally, you might find that both nostrils breathe the same. In that case, stimulate the master autonomic nervous system point on both ears. To find the master autonomic nervous system point, you need to know a little bit about the shape of your ear. On the outside edge of your ear is a rim called the helix. And inside the ear is a ridge called the antihelix. The antihelix is shaped like a Y. It has a stem on the bottom, which splits into two branches, an upper branch and a lower branch. To find the master autonomic nervous system point, look at your ear in the mirror. Then find the point where the lower branch meets the helix of your ear, right over here. Push in to find a point that is sensitive, sore, tender, or painful. That is the master autonomic nervous system point. Activate this point by pinching it 5 times rapidly. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. During or shortly after stimulating the master autonomic nervous system point, you may feel your body relax. Repeated treatments deepen the effect. The next point for vagus nerve activation is Heart 7. Heart 7 is known as Spirit Gate. Research has shown that Heart 7 has a positive effect on brain function. In addition to stimulating the vagus nerve, Heart 7 is used to help with chest pain, irritation, rapid heartbeat, memory, and to improve sleep. In Asia, Heart 7 has been used to help people with autism. Heart 7 is located on the heart meridian. The heart meridian starts in the dome of your armpit, runs down the inside of your arm till it reaches the tip of your little finger, and of course has internal connections with your heart. To find Heart 7, look at the palm of your hand. Notice the crease at the base of your palm, right about here. Feel along the crease till you reach the pinky finger side. Gently push in to find a point that is sensitive, sore, tender, or painful. That is Heart 7. Activate Heart 7 by gently rubbing this point 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, I suggest that you use the round end, and it might look like this. Now find and activate Heart 7 on your other hand. During or shortly after stimulating Heart 7, you might notice a sensation of heat or energy in your finger, wrist, elbow, shoulder, or heart. This is normal and therapeutic. Repeated treatments deepen the results. The third point of this powerful trio is Stomach 36. Stomach 36 is known as Leg 3 miles. It is said that in ancient China, when a peasant was so tired he couldn't walk another step, they would activate this point. He could then walk another 3 miles. Stomach 36 is perhaps the most popular acupuncture point of all time. In addition to activating the vagus nerve, Stomach 36 is used for all digestive problems. Stomach 36 is also used to reduce leg problems like weakness, pain, numbness, burning, and tingling sensations. Stomach 36 is said to help regain balance and coordination and to help with fibromyalgia symptoms. Stomach 36 is on the stomach meridian. The stomach meridian starts just below your eye. It goes down to the jaw, then splits into 2 branches. One branch goes up to the side of your forehead. The other branch goes down the side of your body, on the outside of your leg, all the way down till it reaches the tip. Stomach 36 is located the width of 4 fingers below your kneecap. To locate Stomach 36, find the point that is the width of 4 fingers below your kneecap. Right about here. Then find the point that is the width of your index finger to the side of that. Right over here. Push in to find a point that is sensitive, sore, tender, or painful. That is Stomach 36. Activate this point by rubbing the air quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find and activate stomach 36 on your other leg. During or shortly after stimulating stomach 36, you might notice a sensation of heat or energy in your eye, the side of your face, the side of your neck, the side of your body, the outside of your leg, or the top of your foot. This is normal and therapeutic. This sensation is called Da Qi, meaning good energy. Repeated treatments deepen the effect. If your body is feeling the effects of stress, I suggest that you activate the Master Autonomic Nervous System point, Heart 7, Spirit Gate, and Stomach 36, Leg 3 miles, 3 times a day for 30 days, then use as needed thereafter. And if you know someone who is feeling the effects of stress on their body, I encourage you to share this video with them. It is intended to relax the body and let them get back to enjoying life.
All right. Well, thank you for listening to the video, and I am now ready to answer any questions you have on this subject or anything else that I could possibly help you with.
There is a question in the Q&A box. It says, restless leg syndrome is a major disruptor of sleep. Any advice on that?
Yeah, I mean, I would try activating the vagus nerve. I mean, restless leg is just the sympathetic nervous system is trying to force energy into those legs to prepare them for running away or kicking something or climbing something. So I absolutely would do this exact protocol. Do it for 30 days. I know it's a chronic condition. Do it for 30 days. If that doesn't crack it for your patient, just reach out and we'll take the next step.
Great, thanks. The ear point that you showed,
Yes.
is it on the outer rim or below it? When you in the video showed the Tei Shin, it actually covered, it blocked the view.
Yeah, I know.
where
It was
you were.
hard to do it. I really had trouble finding a good model. That particular point is under the ear rim. Most manuals have to show like a dissected view to show it. But it's not in the outside of the ear rim. It's really on the inside where that lower branch of the antitragus meets. Does that make sense?
I hope so.
Oh, good. Does it make sense to you, Ben?
Yeah.
Oh, good.
That's
Okay,
fair.
fair enough.
Yes. All right. The answer is yes.
Oh, good.
All right. Anybody, any other questions? Type into the Q&A box. No, I think that's it.
Great. Well, look, it's definitely a pleasure working with you, and I look forward to working with you next week.
And there was a question / request for next week. It says, what is next week? And I'm hoping to get, not me, but person saying recovery from substance abuse would be helpful.
All right. I'm going to note that down. I'm going to do a little take a look on, see what I can do. This is a hot topic, substance abuse. So let me see what I can do.
Great. Yes. And we definitely are on next week, although it's a holiday week. We're before the holiday. We are the 23rd, and we'll continue to power through. And that way we will be done by December 14th before the other holidays, and allow people to enjoy their evenings. So thank you all for being on. I don't know if Dr. Baritz, if you have any last words.
No, look, I hope you have a great week and you help a lot of people.
Great. Great. Thank you.